Because of the cases of Anthony Bourdain and Kate Spade this week, we decided to take this interview on the road to UC where we could talk about suicide prevention. During the course of this interview, you'll see a number for suicide hotline. I'm joined now by Dr. Scott Bresler from UC. The CDC came out with something that said suicide rates increased by 25% across the United States since 1999. Why?
I think there's lots of different reasons why. I think there's a lot of stress in our society. I think we don't communicate with each other directly very much anymore. We do it with our thumbs on our phones or through email, and we're losing skills of how to connect with other people, which are absolutely imperative. And then you add into that issues like breakdown in family, very serious drug addiction issues that are plaguing our society, and lots of other different reasons as well.
Is there something that you as a loved one can look out for? Will the person be telegraphing something?
There's no set signals or signs that you can look at and go, that person is, overtly suicidal, right, or is imminently suicidal. Certainly if somebody that you know well has acted in a certain way, they're behaved in a certain way, and then that's changed dramatically, it's worth asking, how come?
Is there a concern that with high-profile suicides, celebrity suicides, there's going to be a trickle-down effect?
Always, always.
Really? Okay.
Yeah, because people look to these celebrities and they put them on a pedestal. We always worry that people would think, well, that's sort of like me, and perhaps I should take that same route in terms of coping with all the stress that I'm dealing with.
If there's one thing you would like to say to somebody who might be watching who is troubled right now, what would that be?
Well, if you're feeling actively suicidal, and you can always take yourself to an emergency room. We have excellent services here at UC with psychiatric emergency services. You can walk in. You can walk in and talk with someone. You don't feel comfortable in leaving the house? Get on the phone and contact these hotlines. These people are very well trained and they know how to respond and can give you pointers and things that you can do to get you moving to combat suicidality. That's what we call it, suicidality, because you have to get into the battle. There's no magic pill, right? You got to find the energy to get into the battle, and people can help you do that.
Dr. Bresler, thank you for your perspective. Really appreciate it. And the big takeaway, I think, is reach out. If you need help, reach out. And we're going to help you do that right now. Here again is that National Suicide Prevention Lifeline number we've been showing you today. It's 1-800-273-8255. And here in the Tri-State, you can also call the Talbert House 24-hour crisis hotline. That number is 513-281-CARE or 2273.